Hi, my name is Tanner Mellinger. I'm doing a presentation on PRP, or platelet-rich plasma. This is my audience. Let me show everybody. And this is my note card I'm going to be using for help, I guess. Alrighty, so I'm going to be talking to you all today about the procedure PRP. It is also known as platelet-rich plasma. The procedure is non-invasive and a new medical uprise that is supposed to kind of help get rid of surgery in certain aspects for stuff such as tendinosis or back pains or stuff like that. I'm going to first talk to you about the procedure that PRP is. There's 7 steps that go with it. The first step is drawing blood. You draw 5 to 60 milliliters of blood from the patient. The most popular way to do this is just through fat. There is also another method, taking blood through bone marrow. Doctors tend to stay away from that because it's a little bit more difficult, and you can get the same cells from the fat. So after you draw the blood, you centrifuge the blood for about 30 seconds to 60 seconds, and that separates the plasma from the blood. You then take it out of the centrifuge, and you separate the plasma and the blood with a needle. After that, you clean the injection area, and and then you get the ultrasound machine out. The ultrasound machine is used to help guide the needle specifically to the torn tendon. You can see exactly which tendon is torn, so you know that the plasma is going to be hitting the exact area so it can heal better. After that, you inject the plasma. It's a very slow injection. You don't just press the needle down. You do it gradually, usually 3 to 5 milliliters at a time. After that, you take the needle out and clean up the area, bandage it, and the patient usually sits on the table for a few minutes to kind of let it settle in, and then that's the procedure. So I did this procedure over this last summer with Dr. Ballard from Texas Sports Medicine. We had an interview and we talked a lot about the procedure and how it's very popular because, like I said, it's non-invasive, so there's no surgery, the recovery time's cut down, there's a lot of benefits to using your own white blood cells and different cells to help yourself recover, rather than going in and cutting, like a lot of people just cut out the tendon, or you're in a boot and not walking. This is just a quick fix, and it can last anywhere from 3 months is the minimum. If it's not lasting me 3 months, then they won't do it again, but he told me it lasted some people 5-10 years, so where they were only having to do it once every 5 years, which is a great alternative to surgery that isn't even guaranteed to fix the problem. So the interview with Dr. Ballard was really cool because not only did he talk to me about all the steps that I just told you about, but he also let me go in and watch a lot of them happen, and I've got to meet with the patients 3 months down the road and kind of talk to them about the procedure. So now I have a little video I'm going to show you to kind of go over and explain a little bit more what it is.
Repair your tear with surgery-free medical care. Have no fear, your body can heal. Instead of opting for surgery, we believe in using your body's natural healing factor found in your own blood. What's more natural than your own body? Accelerate your healing with platelet-rich plasma at Performance Spine and Sports Medicine. Platelet-rich plasma, or PRP, contains healing components that are derived from the patient's own blood. Platelets are cells in your own blood with growth factors that can accelerate healing and can help heal chronic injuries. They are extracted, then re-injected into the damaged area to expedite the healing process. PRP is performed under direct visualization with ultrasound. No anesthesia, no lengthy recovery. Same-day in-office procedure with greater range of motion and long-term relief, something cortisone injections do not offer. Reduce risk of infection. Avoid surgery with PRP and supercharge your body's natural ability to heal. We're delivering what patients want to get better, pain-free, drug-free, surgery-free.
Okay, so the next part, I'm going to talk to you about is the benefits that come along with the surgery. The first benefit I'm going to talk to you about is all the things that it can help you with. Chronic back pain's one, tendinosis, arthritis, arthritis, lower back pain, plantar fasciitis, and jumper's knee. It also, I didn't really get to experience this, but I found out that it can help with hair growth also, which I thought was pretty cool. So those are the main things that it helped with. I watched a lot of sports injuries. I was in a sports medicine area, so I watched a lot of like knee injuries and stuff. So where they tried this instead of trying maybe like a ACL repair, which is a very, very lengthy recovery, they did the PRP, and it kind of helped heal it a lot faster. So the other benefit is going to be a financial benefit. Depending on what doctor you go to, they like to do them in sets of 3, and it's just as you feel you need it. But the set of 3 is $2,500 typically, versus a surgery on a certain tendon that can cost anywhere from $5,000 to $15,000 depending on the tear. So there's a huge financial benefit to it. Obviously, surgical, nobody really likes or wants to go into surgery, so it's a very quick alternative, and you don't have to get cut open and put in a boot or anything. That's the other benefit, is recovery time is immediate. You get the shot, and you're at the doctor's office for 10 minutes, and you're going to be a little sore probably for the rest of the day, but outside of that, you can go back to your regular life after that. Versus surgery, I mean, if you get a ACL tear and you want to get it fixed through surgery, you're out of your sport for a year, and I mean, maybe even longer than that. So it's a very good alternative to surgery and a quick fix that I think is worth the risk, and it's something that is currently going through trials right now to try to get insurance to cover the medical costs. So if that does happen, I think we're going to see a very big growth on PRP, and it's going to become a lot more popular than it is now. So that is my PRP. That's platelet-rich plasma. I hope this helps some of y'all, and maybe you can look into it for some of your back pains or tendon problems or anything like that. So thank you.